it's Jessica DeMassa with WTF Health. With me right now, I have Sadiqa Mahmood. She is the Senior Vice President for Medical Affairs at Health Catalyst. Sadiqa, it's so great to have you here.
It's so good to be here, thank you.
All right, so tell me a little bit, I guess, about Health Catalyst for those who may not be familiar with you guys, despite the fact that you IPO'd earlier this year. So introduce us to Health Catalyst and what you guys do.
Yeah, so Health Catalyst is a data analytics and outcomes improvement company. What we have created in the last 10 years is a stack of technology and services for providers and payers. We have a data analytics platform, a data warehousing solution, and also a series of experts that can work with the providers in different areas, including clinical, financial, operational, and research to improve patient outcomes.
So you started off by saying in the last 10 years, which I think a lot of people don't realize how long you guys have been around and how long you've been involved in data science and providing analytics on data in healthcare. Tell us a little bit about some of the work that you guys are doing, and I know specifically the life sciences business is something new for you.
Yeah, so on the provider side, we have worked in quality improvement, population health space primarily, right? That's where most of our providers want to drive patient care. And if you look at our story, there are plenty of success stories that would come out of these provider settings that have been published and attest to the work and the analytics support that they have received through the platform. Now, in the last 1 year, we have invested in the life sciences business, right? We have the technology, we have the real world data across these providers, and we have access to these providers. How do we best start to manage the unmet clinical need that's out there for our patients? And that is through life sciences business. Now, our customer base in that is pharma companies, biotech, digital health companies, also research organizations that are not hospitals, and then med devices. And we are working with this entire spectrum.
So, okay, unpack this a little bit for me. So I want to go back to the unmet clinical needs of the patients. How are you guys defining that, and how is this going to help?
So think about one example around precision medicine, right? The way we look at precision medicine is if you have genomics data, you can do precision medicine. But when you talk to the clinicians and the patients, that's just half of the picture, right? So what you want to do, and what Health Catalyst is investing in, is bring together the clinical picture of the patients through their clinical data, bring all of the molecular data that lives in different areas, right? It could live in pathology report, it could live in the NGS testing that's done for the patient, it could live in external entities who are doing that testing and providing that information to the providers. We're accumulating all of that to better define patient cohort for targeted therapies and for areas that can define R&D for biopharma going forward.
And so how has the response been with pharma? Like, I mean, this is a new foray for you. You guys have this deep expertise, and you made it sound very simple, but this is very difficult to unite these two worlds of like clinical care and now life sciences. So what has the response been?
Yeah, absolutely. So you're absolutely right. It is a very
Those are like two things that, yeah, wow.
Absolutely. And so far, we're very new in the industry, right? We've only been in 1 year. Most of our team is about 6 months old. The response has been great. I think people are getting used to the idea of what kind of company we are and how we differentiate ourselves from the competitors in the market. And also just this concept of provider access, right? How can biopharma companies leverage that is going to be a process, and some of the educational efforts that we'll have to do for the industry on how we can contribute. But the response so far has been great.
And for you guys, for Health Catalyst, what was the strategy behind this? Because this is, especially in a year where you decided also to, after 10 years, make it an IPO and take the company public. How closely, I guess, were those two things linked? Were they linked at all? Tell me a little bit about the strategic thinking behind going into life sciences at this point.
As a company, we have excelled in the data and analytics space on the provider side. So it was natural for us to think about what are the other areas of potential growth for the business, right? And this is one area that stands out given all of our strengths in this field and the industry. So that was tied somewhat to the IPO, but IPO is a separate decision for us to continue to maintain our independence, and work on the mission that we are on, regardless of which part of the industry that we work with, whether it's pharma, whether it's providers.
No, it's exciting, and I mean, you guys were kind of lumped into 2 other IPOs that happened at the same time, one even on the same day, so it's been exciting though to see, just even with like health technology and digital health, all kind of like coming together and really making a stand, in such a public way and in a market-forward way. Very exciting.
Yeah, it's been an exciting time in healthcare and digital health space for sure.
You guys are like, finally, we've been talking about this for years.
No, we've been very excited to see all the activity that happened around our IPO with other companies that went public during the same time, certainly.
Cool, very cool. Well, best of luck to you as you're rolling out the life sciences business. We'll have to check in with you soon to see how things are really going when you guys actually are, up to your eyeballs in it. Thank you so much for joining us. It's a pleasure to talk to you. I'm Jessica Damasa with WTF Health. Thank you so much for watching.